The honourable member for Saanich Gulf Islands.
Thank you, Mr. Speaker, and I thank the Honourable Minister of Health. This will be the second time only in 6 years as a parliamentarian that I voted for time allocation. I voted for it also on C-37. The question here is urgent, and I agree with the Minister, although I would say that this may be the classic case of the perfect being the enemy of the good. But when lives are at stake, I don't think we can take the time to argue over improvements that, frankly, I would want to see made too. And I'd ask the Minister if she could give us any update on, we know on the street fentanyl is being found in 80% of the street drugs that are otherwise not identifiable as fentanyl. Any update on what we're doing on the ground while we get this bill through the House as fast as possible?
The Honourable Minister of Health.
Well, I thank the member for her intervention, and I thank her particularly for supporting time allocation in this case. I agree with her that this is an exceptional piece of legislation where there's a tremendous amount of urgency, and I always appreciate her upstanding perspective on how to address, as she said, knowing that there may be ways that this could be further improved, but time is of the utmost necessity because of the fact that people are dying. The member has also reiterated, perhaps she read in the newspaper in the last couple of days, that there is evidence now coming out of British Columbia that when you look at some of the drugs that are being sold in the street, the drug supply, that over 80% of some drugs are now contaminated with fentanyl and some of its analogs. This is of the utmost importance because of the fact that we have always had challenges with problematic substance use in society. It's by very nature of society, and as I said earlier, it goes with things like poverty and homelessness and unresolved trauma and the abuse that people have experienced. This was made worse, as the member knows, by the unfortunate reality of overprescription of opioids based on deceptive pharmaceutical practices, and this is an area that we are working on as well with a number of medical educators and regulatory bodies. But what has really made this crisis unprecedented, and this is affecting not just Canada, it's affecting across North America, and now we're seeing even further around the world, is these new, highly potent products. So I'm happy to give the minister, or to give the member, a number of initiatives. As I said, we are working with 42 organizations across the country, educators of health professionals, regulators, to make sure that we understand the work that needs to be done to address overprescription. We are, of course, also working with organizations across the country to expand access to treatment. I alluded in my notes to the fact that we've taken steps to allow products to come into the country, for example, the possibility of using pharmaceutical-grade diacetylmorphine as a treatment option and encouraging multiple approaches to treatment. There is so much that's being done, and I'm happy to update any members who are interested.